lack of knowledge training among therapists in conducting MMPI or MMPI-2. Assalamualaikum and hi awesome student. I will introduce our group member which is Muhammad Khairuddin bin Zainal, Siti Nurjannah binti Zainuddin, Nur Amirah binti Arif, Nur Amalina binti Abdul Razak. Consists me, Siti Hawa binti Mazrodi. Background of MMPI. MMPI refers to Minnesota Multifaceted Personality Inventory. It was published in 1942 by Stroud R. Hatchway and John C. McNeely as the Medical and Psychiatric Inventory. MMPI is a psychometric test that helps psychologists to understand the social, personal, and behavioral issues experienced by mental health patients. There is another test known as MMPI-A, which is specifically used for adolescents. The original MMPI consists of 10 clinical scales. There is also a validity scale that allows psychologists to assess client through and response. It consists of 567 items and takes about 60 to 90 minutes to complete. MMPI is used specifically as a psychological test for clinical purpose. MMPI has also been made mandatory for all election candidates by the Republic of Indonesia. While MMPI-2 subsequent reform took place in 2003 and 2008, which became known as MMPI-2RF. The MMPI-2 or other Minnesota Multifaceted Personality Inventory 2 come in the form of a revised version of the original MMPI as experts began to realize that it consists of 13 defects. MMPI-2 also consists of 10 subscales that are very similar to the MMPI subscale. Also, it consists of 7 validity scales as well. Some examples for these are scales L, scale F, scale K, and so on. To diagnose a person with mental illness is not a trivial matter because it will affect a person's life. As I mentioned at the beginning of the videos, most psychology and psychiatrists will use MMPI or MMPI-2 as one of the tools to assess the mental health of a patient. Many people think that anyone can do MMPI or MMPI-2, but they do not see who is qualified to manage the inventory. For someone who does not have any qualification to manage MMPI or MMPI-2, they certainly do not know how to properly diagnose patients, do not even know about the cross-cultural found in the MMPI or MMPI-2. What is more worrying is if the patient asks an issue related to their self and MMPI or MMPI-2. Surely, those who manage this MMPI cannot give an accurate answer because MMPI or MMPI-2 is very complex and has many items and scales various. Ethics in tests and research can be defined as the code of conduct that is recommended to be taken while conducting research and testing on subject, respondents, study participants. According to Muhammad Hazim and Adi Farudin, 2018, exists the responsibility of psychology to preserve that particular interest and right of themselves, the organization, society, and even the subject of study throughout the research and testing process. These interests and rights are not only important to learn and nurture, but also should be in line with the code of ethics that have been complied by registered bodies such as the American Psychological Association (APA) and the British Psychological Society (BPS). And now I will pass to my member Muhammad Khairuddin.
Now, I will tell you the effect of psychologists that do not have extensive knowledge and training in managing MMPI and MMPI-2. There are three effects. First, the psychologist who diagnose the patient will diagnose the patient without actual knowledge. Second, the test is not suitable for all layers of society. And third, the result will be invalid and unusable. The psychologist who diagnose the patient will diagnose the patient without actual knowledge. When the psychologists that conduct the test were not professional in managing the MMPI test, maybe they will not follow the standard operation procedure or SOP of the test. When the SOP will not follow, maybe the patient will get the wrong result from the psychologist. It will deceive the patient. Next is the test is not suitable for all layers of society. This is because this MMPI test is only suitable for the person at age 18 years and above. These tests are not for the person that 18 years below. It is possible that the individual or the psychologist that don't have expertise knowledge and skill in the MMPI test will give this test to the patient that under 18 years. The result from the test will be spoiled because the person were not enough age to take the test. This means the test were invalid to use. The last point is the result will be invalid and unusable. This is because when the psychologists that don't have actual knowledge in managing the MMPI test, they maybe will give the wrong explanation to the patient about the test. So the test becomes spoiled and the result will invalid to use as a reference. Next, to get the best result to diagnose the patient, psychologists to give the patient other tests to confirm the result. The result is same with the MMPI test or not. Lastly, the goal of the test cannot be achieved because psychologists that conduct the test will not expertise knowledge in managing the MMPI test. So the result of the test will be spoiled.
Competency refers to the abilities and qualifications of psychologists in conducting tests as well as providing psychological services to individuals or groups. In testing and measurement, therapist competence become an issue when psychologists try to carry out the testing process without having formal qualifications and training regarding the tools used. For example, psychologists who try to conduct personality test Minnesota Multiphasic Personality Inventory 2 (MMPI-2) to clients or respondents without having any knowledge and training in the process of scoring and defining MMPI-2. This not only leads to less accurate personality decisions but also has the potential to lead to mental and physical injury to clients. Incorrect diagnosis will in turn lead to treatment processes and interventions that are not relevant to clients' current condition. Therapist competence refers to an attribute of a therapist, not a treatment. Therapist competence in this context may be defined as the extent to which a therapist has the knowledge and skill required to deliver a treatment to the standard needed for it to achieve its expected effect. Psychotherapists have to possess a range of other abilities, for example, more global psychotherapeutic ones, the ability to assess patients well, and the ability to select treatments appropriately. Most of the studies of therapist training have included a knowledge test, but the measures employed have tended to be narrow in focus, concentrating largely on the treatment strategies and procedures. As far as we are aware, no standardized knowledge tests have been developed. So the question is, how do we control or overcome this situation? The assessment of therapist knowledge of a treatment and its use is central to the evaluation of therapist competence. The body of knowledge that needs to be assessed is extensive. It is more than merely knowing the treatment strategies and procedures. It embraces its indication and contraindications, whether it can or should be combined with other forms of treatment, including pharmacotherapy, and any adverse effects like common difficulties encountered and how to address them, and when to abbreviate or extend the treatment and when to abandon it. It also includes knowing what not to do, which is something that's sometimes neglected. For example, not doing things that might interfere with the therapeutic relationship, like ignoring the patient's concern about the treatment, and not doing things that might undermine the treatment, such as introducing elements from other treatments that might confuse or distract the patient. We can also overcome this competency issue by evaluating standardized role plays. It could be a good way of assessing therapists' ability to implement treatments, which is through their performance in standardized role plays. This method is well established in medical education, where it is referred to as an objective structured clinical examination, or OSCE. But it has only been employed to a limited extent to evaluate psychotherapeutic skills. This approach has certain advantages over the therapy quality method of assessment, particularly as a means of evaluating the outcome of training. In addition, psychologists and testers also need to have a clear purpose and understanding related to the use of a test tool. Before using any test tool, all psychologists should ensure that the following questions and issues have been answered. The first one, does this test tool have high consistency and reliability? Does this test tool test the human aspect that is stable and in line with the original goal of the creator of the tool? Is the theory used as the basis of this tool construction reliable and able to give a true understanding of human function and behavior? And are the results generated from this test tool applicable and still relevant for the future? All these questions bring the psychologist to think before deciding on a test tool that suits the need of the client and respondents.
Thank you, Amalina, for the explanation. Hi, I'm Noamir bin Arif, so I will continue based on the Islamic perspective. From Al-Quran, Islam is a religion that is very concerned and encourage people to seek knowledge. In fact, the Al-Quran has played a very important role in the construction of Islamic civilization so that people continue to learn and often investigate something. The evidence is in the first revelation revealed to Rasulullah SAW in the word of Allah in Surah Al-A'la, verse 1 until 5. Bismillahirrahmanirrahim. Iqra' bismi rabbikal ladzi khalaq, which means read the name of your Lord who created. This verse gives very clear signal and common in the field of education. The word Iqra' uttered by the Jibril as was repeated to Rasulullah SAW, emphasizing that mankind should learn, study and seek knowledge. If examined in more depth, this verse educates and invites believers to become knowledgeable people. This early indication is also what has motivated Rasulullah SAW to make the aspect of personal development excellent physical, mental, and spiritual pursuit of other agendas of material and physical development nature. So that's from Al-Quran. In As-Sunnah, Islam obligates every Muslim to seek knowledge as the Prophet ﷺ said, Talabul ilmi farisdatun ala kulli Muslim, which means seeking knowledge is an obligation on every Muslim. The words of Rasulullah ﷺ shows that the obligation to seek knowledge is not exclusive to certain groups only, but the obligation is on all Muslims. The best way to solve the problem is with the knowledge that can be gained from the educational process. So, from the Al-Quran and Hadith, it shows that people need to gain more knowledge, especially to psychologists and counselors. Based on these issues, if psychologists and counselors did not have many knowledge, they will have problem to diagnose people that have mental illness. That's all from us. Thank you.